Hello, my name is Charles Brooks, and today I will be giving you a quick presentation over the treatment of schizophrenia. Okay, the neurotransmitter theory I will use for the basis of my presentation is the serotonergic system. The serotonin receptors are involved in psychomimetic and psychotogenic properties of hallucinogens. The number of cortical receptors are altered in the schizophrenia brains. 5-HT2A and 5-HT1A receptors play a vital role in therapeutic and/or side effect profiles of atypical antipsychotics. Certain polymorphisms of the 5-HT2A receptor genes are associated with schizophrenia. The trophic role of the serotonin in neurodevelopment may be usurped in schizophrenia. The 5-HT2 alpha receptor mediated activation of the prefrontal cortex may be impaired in some schizophrenias. The serotonergic and dopaminergic systems are independent and may be simultaneously effective in schizophrenia. Okay, next we'll talk about the actual system involving a serotonergic. It has been implicated in a variety of behaviors and somatic functions that are distributed in the schizophrenia. Cognition, including memory, perception, and attention, sensory gating, mood swings, aggravation, sexual drive, appetite, to explain a few, are all related to this. Many of these functions are clearly relevant to the etiology of positive and negative symptoms and cognitive impairments, which constitute the core abnormalities of schizophrenia. Functional alterations in the serotonergic system, including both pre and post function, affect multiple neurotransmitter systems. They usually cause various behavioral disturbances in schizophrenia. The effects of using drugs to manipulate the serotonergic system can either reduce or intensify positive and/or negative disorganization symptoms and cognitive function, as well as modify external or prominent functions for this system. Some of the treatments associated with this are fluoxetine, antidepressant, buspirone, clozapine, just to name a few. These are some of the basic treatments utilized. As you can see, psycho properties of depression come from the serotonin receptor backing agent. They just marry up with what particular how they particularly facilitate the actual disorder. Okay, next I want to talk about the treatment. Drugs, the treatment used can help cope with everyday challenges of schizophrenia. Therapy combined with low doses of antipsychotic medication is effective treatment with those with schizophrenia. You have self-help groups, family therapy, rehabilitation, just to name a few, and I'm pretty sure that there are others, but these are just a few that are highlighted. Next, I'll talk about a little bit about the pros and cons. First, we'll get with the pros in reference to getting treatment. You have living a functional life, reduce risk of relapses, fewer side effects, immediate adverse impact is unlikely, and then the risk of long-term problems. So if you getting this treatment, these are some of the things that are positive. Now, in terms of the cons, if you go without treatment, you're going to experience weight gain, drowsiness, dizziness, restlessness, constipation, nausea, vomiting, low blood pressure, seizures, and sometimes even sexual dysfunctions. And there are several others out there, but these are some that I chose to highlight that can affect you on the flip side of that. In summary, over the last several decades, science research and medical treatment bodes well for those who suffer from schizophrenia. Even though there isn't any guaranteed cure established for schizophrenia, it is also significant to understand that those individuals with the ailment still have a great chance for a decent life. As both medicine and science continue to progress, we will be able to efficiently aid others in their quest to overcome schizophrenia. Thank you, and that concludes my presentation.